Welcome to the Global Integral Beauty Networking event, an innovative platform that seeks the best professionals from the global industry to connect and build an interdisciplinary community working together for the benefit of patients. Hosted by Adalis Bailey, global leader in the integral beauty field, a registered nurse with an MBA in marketing, skincare specialist, and CEO of Renew Aesthetics. Adalis Beauty Savvy and Global Integral Beauty, also a best-selling author. This is a revolutionary opportunity to create professional networks in the fields of health, wellness, and aesthetics, driving global collaboration. Get ready to enjoy an event full of connections, knowledge, and innovation. Welcome to the Global Integral Beauty Networking.
Happy to welcome everybody here today on this very important topic of Breast Cancer Prevention and Awareness Month. I'm going to start with a clinical case study. Her name is Mary, the patient. She's 52 years old. Her diagnosis: she was diagnosed 1 year ago with stage 2 breast cancer. She underwent a partial mastectomy followed by chemotherapy and radiotherapy. Currently, she is in remission phase, but she continues to experience severe physical and emotional side effects. Sensitive and dehydrated skin, post-radiation hyperpigmentation in her chest area, hair loss, fatigue, low self-esteem, and episodes of anxiety. Her oncologist has approved gradual resumption of non-invasive aesthetic treatments provided that they are performed by professionals trained in oncology aesthetics under safe, evidence-based protocols. I'm going to ask each of you to answer this general question. And this is a general question for each of you, the three speakers. From your professional perspective, what do you believe is the most important role that aesthetic professionals play in the physical, emotional, and social rehabilitation of women who have gone through breast cancer treatment? How can interdisciplinary collaboration strengthen this process and improve overall patient outcomes?
Our role as estheticians goes far beyond just the skin. It really is that emotional and that energetic component as well. And so, even if you're not trained in certain modalities, just really having that gentle touch and creating intentional presence for that client is really going to help to restore safety, self-worth, a sense of calm when all of this, stressful situation is going on with this diagnosis and treatments, and really just helping them feel seen, feel nurtured, giving them a chance to, have it not be about their cancer for a moment. And, they're going to all these doctors and it's like they're just treating this one aspect. And for us, we get to treat them as a whole person and let them feel like themselves again and not just be looked at from this one aspect of what's going on in their life. And the collaboration between the different professionals is huge. Being able to be in communication with the oncologist, maybe like even a therapist for, the mental health aspect of it, and just kind of creating that full circle support and like creating this like support team for her. And then that way all together, we can really, take her from kind of just surviving to really, really thriving and just reconnecting with her body and her confidence again.
Piggyback off of Elizabeth. It's basically, we are reconnecting with our clients that have gone through that process of the diagnosis and everything. And they essentially come to us, their estheticians, when that first diagnosis happens and their treatments. So we're their safe space. They come directly to us after everything. They're reconnecting. Having worked closely with a lot of women that have gone through that process, you get to know and pretty much treat your treatment room accordingly to the client itself, themselves as well. So you're just revamping everything for them. You're making sure that your protocols are on par and there for them. I use Helen Hush and KPS, for example, so they're very oncology safe products. So you're pretty much restructuring your whole treatment room for your clients and just making them feel heard and seen, whether it's through the touch, you're communicating essentially, and then just making sure that this space is a safe space for them. You are either giving them the quiet time that they need, or you're just there for somebody to connect with and talk through the whole process, everything that they're going through, because it is a very emotional thing. And they just turn to us for everything. And like Elizabeth said, we are just a small component of this whole thing that they're going through. Their oncology teams, their nutritionists, their healthcare professionals. We're just a small part of that, but we are completing that circle and helping reduce that anxiety. And then just complementing all the medical things that they are going through on a day-to-day basis from the start to the finish. And even if they're not getting treatments, a lot of them, at least for me, and I'm sure Elizabeth has noticed this as well with her clients, they reach out to us outside of just the treatment room just to see what we can do for them in any sense of the aspect of being an esthetician for them. And really, we're just not just healing the skin thereafter. It's really just helping them feel whole, reconnecting with themselves, and just being part of the bigger picture. So yeah.
I think rehabilitation phase for breast cancer survivors is a strong phase. We all should have a team to help patient to reconnect again with her sense of identity, self-worth. After going invasive treatments such as surgery or chemotherapy or radiotherapy, patient often faces visible physical change and hidden emotional scars. I think the most important role of aesthetic professional is support patients' physical recovery while promoting emotional healing and social reintegration again. She passed with a lot of mixed feelings. Also, we have to work on restoring the integrity and the comfort of her skin, which has become very fragile, dry, and sensitive, enhancing her self-image and confidence, helping patients again or regain a sense of her sense of beauty again, providing a safe and compassionate environment where the patient feels seen, understood, and respected. This collaboration between the oncologist, dermatologist, psychologist, nutritionist, and even aesthetic practitioners will receive a holistic approach. Each professional contributes specific expertise that together optimize recovery, reduce complications, and improve patients' overall quality of life.
And Dr. Reem, since you're already here, I'm going to start with you, all right? So,
Yeah, okay.
and I appreciate everybody. You're wonderful. From a dermatological and aesthetic medicine perspective, what are the key skin considerations and contraindications when treating post-oncology patients? And how can technology and advanced skincare protocols safely help restore the skin's health and confidence?
Well, let's start first by saying that post-oncology skincare requires an individualized and cautious approach as the skin barrier and the immune response remain compromised for months and months after treatment. Let's say we have a case with increased skin sensitivity and dehydration due to chemotherapy and radiotherapy, very fragile capillaries and reduced healing capacity, post-radiation hyperpigmentation or fibrosis in localized areas. We also have hair loss and scalp sensitivity, possible lymphatic drainage issues after a surgery or radiotherapy. We have many contraindications in this case, as any invasive or heat-based treatment such as laser or radiofrequency microneedling, even strong peels in previously irritated or recently treated area are a strong contraindication. Aggressive massage or mechanical stimulation in these areas are at a great risk of lymphedema. Using perfumes, irritation, or even heavy products such as retinoids, alpha hydroxy acids, or beta hydroxy acids will be at a great risk until full tolerance is verified.
Elizabeth, I'm going to ask you a question now. Okay. As a holistic esthetician and educator, how can we integrate mind, body, skin connection principles into oncology aesthetics to support emotional healing and self-acceptance during the recovery process? And what role does education play in empowering both professionals and patients as well?
Yeah, I love this question. So my whole philosophy in my my practice and in what I teach is the connection between our emotions and the skin. And our skin truly mirrors the mind, our emotions, and what's going on internally. And so especially for, clients going through oncology, this is huge. I mean, it's taking such a toll on their body, but not only like their mental and their emotional health. So this should be like the strongest pillar that we, look at when treating these clients. It truly is like the foundation of holistic healing. And so, for example, like in my practice, I use techniques like breath work, aromatherapy, Reiki energy healing, sound healing, and just different various treatments to help kind of like calm and regulate the nervous system. Of course, some of these things you have to be certified in to make sure that, you're practicing them properly, and also, getting consent from the client and making sure that they're open to those types of things, but it can really help the outcomes. And kind of what some of the others said before is just like creating that safe space for like self-acceptance and for them to like truly feel like at peace. I mean, when they were going through all their treatments, I'm sure they've been to all these doctors' offices with these like crazy bright lights and these, all these chemical smells, and which is just, overstimulating their nervous system even more. And so creating a space where they can really relax and really practicing active listening and letting them be a part of the treatment plan. So asking permission for everything, asking what kind of music they want to listen to, what kind of smells they want, really letting them pick a lot of things and creating like an environment that they get to feel a little bit in control of when they just went through this huge life-changing diagnosis that feels extremely out of control. And that's really going to help empower them. That's a huge part of it. And then education, absolutely. It's a very delicate situation that's going on, and so making sure that you are oncology certified, not only with the products and making sure that you're using the right products that are okay for the skin while they're going through that, but that mental, emotional side of it as well, like even just little, things that you can say or do, or little tweaks for maybe the average client that you wouldn't do to help you understand what that person is going through, and just again really creating that sense of safety for them. So knowledge is power. That knowledge with the compassion combined is kind of like that true healing like sweet spot, and then it comes more than just skincare. It really becomes like soul care for them.
Ashanti, I'm going to ask you a question now. From your experience as an advanced skincare specialist and entrepreneur, how can estheticians create inclusive and compassionate spaces for clients who have gone through breast cancer, ensuring both emotional comfort and professional excellence during treatment sessions?
I love this. Okay, not to nerd out, but with the clients that I have had in the past that have gone through their treatments, their diagnosis and everything from start to finish, I really dive into what it is that makes them feel good. Before the diagnosis, they were my clients. And I feel that as service providers, we're providing that safe space. We're providing very catered services to our clients. So from the beginning to the end of the whole process, I know my clients well enough to know this is what my client likes. Let me go ahead and go above and beyond with the things that they like. They like a warm bed. Let me go ahead and get that comfortable for them. They like scent or non-scent, but I still like to make sure and communicate with them. What are you sensitive to now versus before? What has changed? What do I need to do differently for you? This still is their safe space, everything and anything that they need to make the experience that much more catered to them and making them feel relaxed, I'm going to do for them. And sending home whatever they need for their home care. It's just just that above and beyond, making them feel just like $1 million, considering everything that they've gone through and how they may be feeling. Let me do a little bit extra for you to make you just feel like just special and great and a whole again. And as estheticians, I do feel that it's our responsibility to make our clients just feel great at the end of the day. And as soon as they leave, they feel better than they came in that day or that week or whatever's going on. We do owe it to them to just make them feel loved, love on them because they've gone through so much.
Elizabeth, could you please share your experience today? What was your expectation when we invite you and be part of this networking event?
Yeah, I'm so honored. Honestly, this is incredible. And you're right. I misspoke in the beginning where I said, "Oh, I'd love to be," but you're right. I am. I'm an internet. I mean, it's huge. Like I'm getting chills. This is incredible. I'm so grateful to be here with this amazing panel and all of you. And I hope to get to the live show next year. And yeah, this topic is like my mission to be more a part of this information being available of that missing pillar of creating that emotional safety for clients in the treatment room and not just what's going on with them topically. So this has been incredible.
We're going to continue with Shanti. Could you please tell me what was your experience today and your expectation when we invited you to be part of this network?
So first, I was honored to have been nominated at the award show, even though I couldn't have attended. But to then have been asked to be a speaker, my jaw was on the floor. I am not gonna lie, I was really just honored and thrilled considering the topic. It is a very dear topic to me because like I mentioned earlier, I do have several clients that have gone through chemo, and I have a friend currently that's going through reconstructive surgery this week. So all of this just kind of coincided, and it just felt right to be able to provide whatever little bit of information that I can, because it's such a huge topic, and I'm just really honored. And to be an esthetician that's a part of the process and healing and helping people heal, I'm just yeah, I can relate with Elizabeth, the emotional aspect and the connection that we both have to the topic. So yes, thank you so much, Dallas, for having me here today.
Dr. Rain, I would love to know and hear from you. How was your expectation to be here as a international VIP speaker?
I really enjoyed this conversation for having all aspects of breast cancer from different points of view, from different visions, from different countries. We all have the emotional support for breast cancer survivors. We need, and we all want to give them all the support they need to reconnect again with themselves. We all do our best to give all our knowledge to help them be the best of themselves again.